Start.
Hello, everyone. Okay, so hello, everyone. Welcome back to my channel. So, okay, most of you people know me. If people who don't know me, let me introduce myself first. My name is Dr. Kavita, and currently I'm working in a UAE hospital. Okay, so today I came for you all to discuss because last we done session and I positively got so much response. So for that, I thought why not go for another session before the OSCE season off to help you all whatever maximum I can do. But sorry, I couldn't continue on regular basis, but I tried. So today we are going to discuss some OSCE cases which just held before, started in this OSCE October Colombo, which is going on. Okay, so one more surprise for you all that to take a real-time exam and real-time experience from the people who went through this OSCE, especially it will be more helpful for those who just have OSCE in their 2 days like coming up. So one of our doctor, one of my colleague, one of our friend, she also appeared in OSCE. She's from Pakistan and she had done MCPS family medicine and now she went through the OSCE. On the first day of Sri Lanka, she was the candidate of the OSCE. So let me welcome to Dr. Rakshanda. So she's going to help us to tell us what the actual scenario and how it's going on. So, Assalamu alaikum, Dr. Rakshanda.
Walaikum Assalam. Good evening. Thank you, Dr. Kavita, for having me.
Dr. Rakshanda, can you just voice up, like loud up your volume because I think it's not audible easily. Hello. Doctor, are you there? Okay, I think must be she's checking mic and all. So, hello, doctor. Are you there? Okay, till she join us back. Today I'm going to tell we'll discuss as possible as the cases of OSCE which just came in these days because I have some list of the cases the TB suspected, TB diagnosed, TB contact came in the OSCE, VDRL report, and many more. And this is okay. One more thing I was shared before as well in my previous session. If people don't know, they must go through that. This is mostly on about your session. Okay. So this is it's about the how you perform. It's about your communication, mostly situation, not about the diagnosis. And this is what I got the feedback from the people who went through OSCE. Okay, so this time also they came like they are not worried about the diagnosis most of the time. They are asking about the situation. Just let me throw just introduction about this thing. What we get in the hospitals, in our GP clinics, patient come. Do we regularly tell every patient that you are suffering from this diagnosis, or we wait for the other visit, or we usually try to work up on that, or we want to but must make him pain free or here. So okay, Dr. Rakshanda is back. Just Dr. Rakshanda, give me 2 minutes
I'm
to complete.
sorry. I think I'm so yes. I'm so sorry. There was a connection issue. I'm back.
It's okay.
Continue, please.
It's okay. No problem. So this is what I was talking about, that we are like not telling the diagnosis on the first go. We usually work on that. We try to relieve the symptoms or pain of the patient. This is what the MRCGP asking for us, because we are GPs. We are not here for internal medicine or any this is other thing, and we have to understand this. So, okay, now we will continue with the same thing, but let's Dr. Akshanda is back, so let's listen. Okay, so Dr. Akshanda, how are you?
I'm fine. Alhamdulillah, I'm fine. Can you hear me properly now, Kavita?
Yes,
Can you hear?
Yeah. Yes, of course,
Okay.
yes.
I do want to agree with Kavita that my experience was that yes, they were more keen on how we were communicating with the patient especially, the way we entertained the patient, we talked to the patient, and our communication with the patient was very, very important. So yes, the diagnosis and the things that were going on, like the case was unfolding, was one thing, but of course, the main point is, like, we have been told by everybody and Kavita as well, that it was the communication, that how the patient was satisfied with us, the SP, how the SP was satisfied, and how we listened to the SP. Yes.
Okay. See, okay, Dr. Rafshanda, so just before starting the proper cases, I'm just going to ask you, I don't know if you heard my session the done I before the day starting, yes, in the night from the OSCE. So if you listen or you was present in that session, that does it was helpful for you? Because I want to like tell them like it's going to helpful or not, because I don't want to waste anyone's time.
No, no, yes, I agree. Although I had the paper the next day, unfortunately, I couldn't attend before that. But I took the session. I listened to everything that Kavita said, and especially for her very good advice to, keep smiling. And when you're smiling and you enter with confidence, that brings your presentation and your work up to a bigger level. So that was really good, because we were in so much stress. We were in so much stress that we had actually forgotten this very key point. And after you told us in the session that do remember to smile and keep a good demure when you enter. So that was very warm. That voice was ringing in my head. Trust me. So no, it was very
So
helpful.
it's a good
You were
thing,
very
yeah.
helpful. Thank you.
मतलब ऐसा
Yeah, it was good.
बिफोर वन डे वी कैन हम ये कर सकते हैं, क्योंकि बिकॉज ये होता है कि हम बहुत सारी चीजें थ्योरी याद रखने के चक्कर में इंपॉर्टेंट चीजें जो होती है परफॉर्मेंस उसको भूल जाते हैं, जो कि हमें नहीं करना चाहिए, राइट? द मैसेज वाज दैट ओनली. ओके, सो रक्षंदा, हम स्टार्ट करते हैं वन बाय वन केसेस. सो कैन यू टेल दैट व्हाट वाज द फर्स्ट केस?
The first case that I got was of the 55-year-old male with a report. He has come with a report, and he must was that one, the one with the there was blood cells 7 to 8, and there were pus cells also around 6 to 10. Some green report, and the patient was a male, 55-year-old. That was the first case that I got, and
ओके, यस यस, कंटिन्यू.
it was just and there was the note that was written outside was that discuss, do the consultation, discuss management plan. That was the thing. So
ओके,
when we
so yes, so how you proceeded, like entered, and then they started with the history, right?
yes.
So what you realized at that time, like, see, as you said, you got the report of the 55 and the scenario was, and they gave you the report, right? Exactly.
This report done, what was the reason? And he said that, no, I don't have any problem. I only got this test done because I have an insurance thing with the company that I am working with, and this is for a job appraisal that we have to get these tests done. I got this test done with a lot of other tests, and when the lab person told me that there is some problem with this test, so I have come to you. So basically, he was not having any complaint. When asked, okay, do you have any pain, do you have any other issues, do you have any urinary problem, like specifically I asked, okay, do you have any burning, have you ever seen any change in color of your urine, or if you have any problem with your stream or something like that. He said, no, I don't have any problem. And I only got this test done because of the company thing. Okay, so because I had this thing in my mind that maybe he works in a dyeing or textile or something like that, chemical exposure thing. So I asked him, where do you work? And he specifically, I asked him, okay, what do you work in the office? He said, no, I think he said, I work in a trading firm, and I'm in a manager position. Manka, you don't have any exposure with any chemicals or anything? He said, no, I don't. And other than that, I also asked him about any family history of any same issues or anything like that. So he said no. History of travel was also a no. And the only thing that he said along with all this history is that I had pain in my back and in my knee about 2, 3 weeks back, and I took ibuprofen for that. So that these were the things that he told me.
Okay.
And after that, I asked him about hypertension, diabetes, any chronic issues, and he said I'm not on any medication other than the ibuprofen, and I don't have any hypertension or anything other than this. General social, psychosocial history and everything I asked also, and then
Mhm.
I asked him like, why are you worried about this report? What is your major, issue with it? So he said that one thing was that the lab person told me there is something wrong, and the other thing is that I got a issue that my son has just moved to Australia, and I have to pay for his fee and thing like that. So I am very worried that if I don't get this appraisal, it will be a problem for me. So that was his major, one concern that he was worried about, and that's
Okay.
all. Then. Mhm. So after that, when I went for the examination, I said, okay, fine, whatever you have told me is fine, but I want to examine you. So in the examination, I did the vitals. The vitals were not mentioned on the script, as far as I
Okay.
remember. Yes, they
Okay.
were not there. So I asked about the vitals, blood pressure and written rhythm and fever and everything. And then did the general physical. I checked for anemia. I checked for his hands and everything. And then I did an abdominal examination, in which he said that there is no pain anywhere. He did not mention any pain. And I also said that I would like to do a, DRE, digital rectal examination also. So the
Mm-hmm.
examiner said no, there is no need for that. And then when he came back, I thanked him, came back, sat down, and the examiner told me the finding. He said that the patient's vitals are normal, his general physical is normal, and there is no findings in the abdomen, and the DRE is also normal. He said the patient is normal. The examiner gave me the findings. After that, I just, then I explained to him that, what I think, that it's a possibility that since you don't have any complaints, you don't have any problem, then, and you don't have any red flags in your history, I don't think that it is a very serious problem, but your report is not fine. And I think you need, further evaluation. For that, I can advise you a few tests. And I asked him that, I'll get repeat another CBC, for which he said I already got that done, but I don't have the report. And I said, okay, fine. I would also like to advise a prostate specific antigen, and I will, ask for urine DR again. So he said, okay, fine. And after that, I said that there's not a lot of problem in your report, but seems to be a problem, and I'm going to advise you to stop taking the ibuprofen that you are taking. It's a possibility that maybe the ibuprofen is causing this, and I will refer you to a urologist for further workup. And I'm sorry that I cannot make you clear on this report that you are fine, because I know your major concern was for your son's job issue. But you need to see a urologist for this. That's what I said. I don't know if it's right or wrong, but that's what I told
Okay.
him.
No,
And
I
he
was
said,
listening you with this
fine.
case because
Huh?
from you the reason. Okay. So see, what was the finding on the report?
It was showing red blood cells around
Okay.
7 to 8 something, if I remember properly, and
Okay.
pus cells were also there. But those
Okay.
were the only two positive findings. That's it.
Okay. Okay. So okay. See, age was 55, right? And he wasn't complaining,
Yes.
giving history of any hematuria or anything like that.
No, no complaints at all. Painless hematuria was. Yes.
Okay, sir. Okay.
No
So
history
see,
of
this is a
fever.
good thing that we can't ignore the because of the. Is there any history of weight loss?
No, no, no. I said there were no red flags. I asked everything. No, no
Huh.
red flags at all. No weight loss.
Exactly, but we want to because of the age and because of that, it's you explained it nicely that we need to like have to refer this patient in evaluation. Anyhow, it wasn't anything, but we can't leave the patient because of this, right? And
Yes.
before doing the
Yes.
referral, the good thing is that we need to repeat the urine again because we never know. It might be, sometimes it's happen like this is not a significant hematuria actually. Even the micro, we can't say this, right?
Yes.
So it's
Yes,
better.
I asked
The
him.
best thing is that we always on like these sort of cases, if you don't find anything, go ask for the red flags and just tell them. And after, okay, all the scenario was you have done most of the time, like it's correctly. But have you told him that you have to after, like if in between even you are going to urologist or not going or repeat the test in between, if you feel any pain or any hematuria, blood, red color urine, you have to come back or don't like stay at home, anything like that? You explain.
So I did tell him that if you feel any pain or burning, or if you see any change in color of your urine, then get medical help immediately. You need to see a doctor. But for
Very
the
good.
time,
Yeah, this is what, like, see, we should show the concern exactly, and this is what you have done, and this is what we need to done. This is how it goes on. That patient listen, patient advice is what the concern, because sometimes patient tell concern without we are asking the eyes, ideas, concern, and then so sometimes patient told us, so no need to like go for okay, just mention to tell the examiner. How you will tell the examiner that we have know the concern? Say, okay, as you told me that you are concerned for your son and that you have to pay and all these things. So just mention it and continue with the flow. Don't break the flow that, okay, don't go for step by step that, okay, what is what is your, what you think, what you have, what you are worried about. No, it's not as necessary. Sometimes patient telling you most of the time, like Rakshanda will tell the more, but anyway, I have also went through the like 50 to 60% cases was that they are telling the concern why they are worried and what they want from us. So even there was no need to ask this thing. I think this is pretty much easy case. It wasn't that much difficulty or anything was it, or I couldn't find the any clutch. The only see back pain was there. So this is something which can be there is a okay. We also should advise the ultrasound. KUB for this patient or ultrasound prostate instead of that, so that we can see the prostate size as well. Okay, this is something we need to advise as well at the investigation. And also for because he having the pain. See, prostate cancer, if it's suspecting that go to metastasize to the bones easily, right? And the patient usually present with the pain as well. So, and have you asked the history of any family carcinoma history? Because this is also need to
yes,
ask. Yeah, okay. So this is what we
yes, I
got
asked.
the questions. But best thing, explain. And if you don't know, see, sometimes I don't know the diagnosis, what should I do? If in real life my patient will come, I will say, okay, see this, up till now we don't know, so I will consult with my colleague urologist and I will try to discuss this case or whatever. So I gonna make you a referral, so that it's better to visit them as well. Simple. Because you are a GP, just understand the point. We are not wholly all the multidisciplinary team, but we have to involve the team. Okay. So okay, so continue. So what was the next case?
Okay, the next case that I got was a young man with he has come with his complaint, do a focus examination, consultation, and make a management plan. So when I went in, I started the history and I asked him what is this problem, and he said that he has been having loose motions. I think it was around a week, and he said that I was fine before this, and I suddenly started getting this loose motion. And of course, when I asked him all the history about that, are they painful? Do you have any fever? Do you have anything else? He said, I had fever around 3 weeks back, and I right now only my stool is there. Yes, one thing that he mentioned was that there is mucus. He said there is saline and mucus in my stools, and he said that they are foul smelling, and but I don't have any pain. Okay, he didn't have any pain. There was no blood in stool. There was no pain. And when I asked him about history of weight loss, he said, no, no, I don't think I have lost a lot of weight. And appetite, I asked, he said, yes, I'm fine. I'm eating fine. And I asked him, okay, what do you think is making this worse? He said, no, I don't think that anything makes it worse. It's just there. And I asked him what makes it better. And he said, no, no, so far, nothing seems to make it better. And then I specifically asked about, travel history. And that's when he said that, I work in a company and I have to travel a lot. And even around a month back, I was traveling and I was out. So I asked him, okay, what did you eat there? Do you think you have eaten from outside or things like that? And he said, yes, sometimes I have to eat from outside, but I try to eat from clean places and I don't eat from the road or anything. And I asked him if there was somebody else with him also on that travel and are they sick? And he said, no, I was there alone. Nobody else was there with me. And I don't like that. So, and same thing I asked about water. That were you careful about what kind of water you were drinking? He said, yes, I was drinking, bottled clean water. Then when I asked him that if there is anything which is causing him worry or which is making him stressed or is there any problem at home or his workplace, so he told me that his father had been diagnosed around 2, 3 months back. And he said that because my father also had same kind of symptoms, that is why I'm very worried that maybe I might have, cancer. So that was one point that he was worried about. And he told me, and then so like I asked him about, when his father was diagnosed, how he was diagnosed, the family
Okay, father had cancer of what thing?
he drinks, things like that. But he said he doesn't smoke and he doesn't drink also. And apart from this worry about his father, there was nothing else which was of bother to him. His relation with his wife was fine, his work was fine, everything else was okay. And as far as I was concerned, then I did the examination. And examination again, same thing. I did the vitals, and then I asked about, I did the general physical examination, and especially I looked for all the signs of dehydration, checked for anemia, any jaundice, anything like that, and there was no positive findings.
Okay,
Abdominal.
yes. So it seems like the case was like traveler's diarrhea, isn't it?
I don't know. It seems like it, but very honestly, Kavita, I myself, right when I was sitting there, I thought it was, IBS. I said it's irritable bowel. I said it's irritable bowel syndrome. Very honestly,
Okay,
and
no
I went
problem,
with
no
that.
problem. See,
My
I've
diagnosis was
told you
that.
before, we can misdiagnose it. It's not about diagnosis. This is how we approached. So, like, see,
Right.
whenever any diarrhea patient came, just a general patient coming with the diarrhea, the four things we need to ask immediately that should click our mind. Obviously, we will ask how duration and how any recent travel history. Is there any fever with that? Is there any like bloating or something like that? Or it is on and off or not, like this is the four things. If we will ask, we will, most of the diagnosis will be ruled out and ruled in. Okay, so this is how like diarrhea is something. Okay, is there any serious weight loss is there or not? So he was a young, but anyway, red flags we never need to like forget about this thing. Any blood in the associated with there, as you all asked, and already he told mucus, is there anything? So it seems like this way. So, okay, as per examination goes for almost every patient is same. Like we start with the general physical examination and then focused examination. This is what the difference we used to do. See, what if I got the patient, like you are my patient, like you came in my OPD, or what I will do? Like I seriously go for the all the examination? No, I know don't. So if you don't perform this thing in your regular practice, then they don't expect from us that we will do there. If we are doing some undergraduate level things, which they don't like, you know. Their examiners, their SPs are very, very well trained. So we need to understand, this is for those who have OSCE like nearby. So just go for brief history, focus examination, and try to like summarize the case, and also like ask, okay, this is what. And his concern was, see, his concern, something which actually not related to his illness, but we have to resolve it. Okay, so how we will resolve, as I'm damn sure Dr. Akshanta, as she told up till now, so she had done so far so good. So we have to, the main concern is important. Why he came all the way? Is it a diarrhea? Okay, diarrhea is a first, like we have to resolve that problem as well. But meanwhile, also we have to come back with the concern. He was concerned because his father has carcinoma, so he might thinking something I also have. So we will tell them, okay, we will do workup if required. Anything, first start with the nation, and after 1 week you should come and we will discuss and everything. So this is how it goes on, isn't it like that, Dr. Dukshinda?
Yes, absolutely. That's
Yes.
absolutely what I did. I
Oh,
also advised him and told him that, this is what I think you have, and you are having a lot of stress because of your father. That is also, acceptable. It's okay since you have had such a difficult time recently. So I will do test and then you come back with the report. But let me tell you that you don't have any red flags in your history. You have not told me
oh,
anything
okay, okay, okay.
currently which
Okay, I'm
seems
pausing you here.
dangerous.
Okay, Dr.
Hmm.
Nishanda, do you said this patient to that you don't have any like red flags? Because this is
Yes, I
something we
did.
don't. Okay, red flags
No,
we
I
are not
did. I
supposed.
did. I said that. Yes, I said that.
Yeah.
I said that. I
Okay.
said
Okay.
that.
See,
Yeah.
this is the because
Hmm.
we
Hmm.
I was I can do. So this is we used to say any red flag. Patient don't understand red flags because
Right.
they are not. These are for us. This is for us. We doctors and then we know
Hmm.
patient coming because he don't know the. Okay, I will tell you the some real time story, a real time case which actually come in the OSCE as well, not in my time, but some my colleagues. What was happened? The patient came with the complaint of that like shortness of breath. There was swelling and itching around. Basically, simple allergic reaction was there. And then I took the history, and the patient told me this is this, and I had something, and like I don't know, but unknown substance allergy it was she developed. So anyway, anti-allergy given, and she maintained. And then when I was like asking about red flags, and she get worried. She said, "Doctor, like, do you think I will develop that much anaphylactic shock?" And then we have to explain, no, you it's like no, but it can be. So if anything, you should come here. This is something we are not practicing, and we suddenly present with the doctor patient. They will say, "What the doctor is talking." So go with the thing. Okay, one more thing I have learned here, like working here, and give the information only which is required, which is patient asking. Don't give more information that is going to harm us in real life, in exam life. No needed. Patient understanding, patient concern resolved. Don't tell that, okay, see, this is what happening in your diarrhea, your gut's getting high hypermotility or something like that. No, why? They don't need it because if they are not asking, we are providing. This is going to be waste our time as well, waste our energy as well, and this is like something which is not presentable because even in the real life we are not supposed to tell that okay, this I'm going through this, and this is what going on. Try to limit yourself. You go as a consultant because this is the only gate exit. Now after that clearing, you are going to be consultant, you are going to be specialist. So present yourself as a specialist. Do a specialist ask. It's not I'm like a gp specialist. Okay, so just feel the difference, what we can change. Okay, so like it's for all, like it's not for Dr. You. Like it's just generally the point came in my mind, so I wanted to share all that. Present yourself and limit information. Don't give more, like don't medical jargons is actually the cause of sometimes we don't realize because we think they are doctor, examiners are there. No, think it's a real time patient. If you will go like that way, that is going to help you a lot. If you think it's a real time patient is there, don't take it as SP. I have heard with one of my colleague. He had exam 2 days before me, and he said, "Doctor, I went. SP was roaming here and there, and then they are expecting us to like take him the real patient." Eventually, he couldn't clear it. He was like he had done MRCP and most of the things, but he couldn't clear it. The reason was only that we can't we have to accept the fact that the SP can be roaming. You can see outside even the like before starting the exam or the hair. It's very rare anyway. During when you get the break time, at that time they just they take around because they are also get tired. 14 station in a row for 10 minutes each, and it's including the rest stations. It's not easier for them as well. I went through exam for sometimes we think examiners are like why so rude, and why actually they are not rude. They get tired with the time. They get tired. It's not easy job as well. So I went through one of the examination as an examiner. So that is also a tiring job. Even anyway, student getting different cases, the examiner sitting on the same case and talking, and SPs also get tired because the same thing they have to tell each and every patient over, like a doctor over there. So just bear this thing, okay? Okay, so let's move to the next case. Yes, Dr. Rakshanda.
The next case I got was again a young man who came come up with a report and he wants to discuss the report with you, do a consultation and a management plan. The examination was not required.
Okay,
So when we walked in and asked the person, he said that this is my report, and can you tell me what is there in the report? And the report showed VDRL positive.
okay.
Okay. So again, started taking the history, and I asked him that, do you have any problems? Do you have any complaints? Why did you get this test done? And he said, no, I have applied for a job in a foreign company, and
This is very favorite.
because
Okay,
of
I'm just
that job,
pausing you, Dr. Rakshanda.
uh,
This is a very favorite. Like it's something I reports are their most liked topic. They present. You know what? Have you realized up till we done with the three cases, only diarrhea was something that is something to be related to like diagnose or the common practices. The report. This is something, isn't we get the daily practice, but we don't know how to respond them. Isn't it like that?
yes, usually, yes, you're
Exactly.
right.
They are giving us situation, they are not giving us diagnosis. If VDR positive, what you think that we will have to tell the like exam diagnosis? No, they want to know in real life if people are coming, how we will react with them. If patient coming with me, okay, doctor, this is a VDR, the report I have done for the insurance and all, but I got this thing and but I want to change the report. Very common scenario, very common. So many came like, doctor, please can you change the report, I will pay you or something like that, or please just do a favor, it will otherwise ruin my life or family or anything like that. So this is the case they presented. Okay, VDRL report, then we have to like approach the way. Okay, so we will listen further case what is there, then we could discuss more on this. Yeah, continue, Dr. Chinda.
So when I asked him that, okay, fine, you applied for the job, but what do you do? What is your profession? What do you do? And he said, I'm a truck driver. And so I asked him, okay, fine, you are a truck driver. And again, coming back to the report, since you have gotten this report done, I have to ask you some personal questions, some private questions, if it's all right with you. And he said, okay, fine, you can ask me anything. So then I asked him about all his sexual behaviors. That does he have, multiple sexual partners? And I asked him what his preferred, mode of intimate relationship was, whether it was the natural or maybe the back passage or anything like that. And he said, no, if it's normal. And then I asked him what his preferred, companion one means, male, female, or both, or all that. And he said, no, I prefer female only. And I asked him if after, going on these trips, and he said, I go on trips a lot. I said, okay, fine. Whenever you go on trips, do you actually have sexual intercourse? And he said, yes, I have very long trips and I usually do end up, going into a relationship, having intimate time with people. And then I asked him, and he said, no, I don't use any kind of protection. Okay. So then
Okay.
I asked him that, do you have any, then I came to the history, do you have any discharge? Have you had anything like this before, that you have any discharge or anything on your private parts or anything like that? He said, no, I don't have a problem. I'm absolutely fine. Since the examination or anything was not allowed, so I didn't say anything about that. And then I asked him about his personal life, like, are you married and things like that. He said, no, I'm not married, but I do have a fiance. So again, actually asked him that, do you have any relationship with the fiance yet? And he said, no, right now I don't have any intimate relationship with the fiance.
Okay, great. So one thing, very nicely, you have like up till tell me that these things. This is very important. Don't feel shy, but take a just
Then, when I
permission that
asked
we
him
are
that,
going.
is there anything else more important for me? And I have applied to
Yes.
go ahead
So
with my job.
very, Dr. Akshanda, I'm going to tell some points over here. See, this is what you should done very nicely. That very good. You have to grant very good. That we take a permission and we'll ask the, okay, so we are going to discuss some confidential things. So is it fine with you? So they obviously we need to ask because to help you out or this to resolve this problem, whatever you came from, because he wanted to change the report, right, Dr. Akshanda? Is that not like the case?
Oh, when I asked him that what I can do for you, he said, "You tell me how to get treated, what I have to do, and you tell me the
Okay,
treatment." No, he did not. This was not ethical issue. He didn't ask to
okay,
change the report. No, no, no.
okay, okay,
No,
okay.
he
So
was
I
just
have heard that
concerned.
it
What is
came like
wrong?
this way. So someone told me, okay, okay. So he said, what like what to resolve because unexpectedly something come out, right?
Yes, yes,
Okay. Okay, great. So, okay, for this patient, like as Dr. Rachel, so this is something we don't need to shy that, okay, how can I ask some person? This is our job, this is we have to do. Only thing, take a permission. There's something very important. We are going to discuss so much personal things. They wouldn't shy. You are male, you are female, like medicine does not come about the bias to be like doctor, female patient or present, anything. This is the basics. We know this thing. Just take a permission and go ahead. Once you do come to know, okay, this is the issue, this is the problem, then we have to go for further, because VDR is not a confirmed to diagnosis, we have to repeat the test and also to go for a TPH and also tell them that we need to trace the last 6 months when you have to done with something, like what is your relationship with them. And then also we will, once after getting TPA result, then we will start with the medications, the treatment, and also we'll tell that safe practices better to avoid. If not, go for safe practices. Okay. Hello. So this is
yes,
how we
yes.
will do. Yes. So like this is the next thing we have to do. And then what? Any other concern was the patient's? Any other concern? He presented with any other concern?
No, when I asked him if there's anything else you want to know, because I told him all this that you just said, okay,
Very
safe
good.
sex
Yes.
practices, use condoms and do this and do that. And then I asked him, do you have any idea about the contacts, the people you had, intimate relations with? He said, no, I don't know anybody. So I said, okay, I'm going to send you to the gum clinic, and then they are going to test you also again for other diseases as well. And,
Very
they
nice.
are going to treat you, and then they are also going to find out, it is their job, they will do it, but you need to go to the gum clinic. They are going to do contact tracing, and then they are going to help you. And then in the end, when I just asked him that, is there anything else I can do for you? He didn't ask me for to change the report or anything. He said, what is the treatment? Is there anything that any way I can get treated for this? That's so I told him that yes, there are injection, there is a treatment, and there's injection, benzyl penicillin that is given,
Exactly.
but to have an allergy test for it. I need to get you tested before I can give you the treatment for any allergy reasons. And he said, okay, fine. Then I was out of time, so there was nothing else to do. Yeah.
Yeah, that is the good thing. That is we need to do. This is how it goes on. We need to tell if we see sometimes SPs like we think like when before going exam SP will like distract us. No, trust me, trust me, trust me. 60 SPs are going to help and not actually help. They wouldn't like help us that okay, give the clue. No, but they are trained like a patient. So see, patient want to know what is going through me, so they tell everything. Even same for SP. If we ask something, it's going to tell. It's just we need to dig out what's going on. See, if we don't tell treatment, they will ask you and just tell them. Because for this case, if she wasn't telling me or any doctor not telling this treatment, that is fine because we need to repeat and confirm the diagnosis first. Okay. So we are going through and it's still asking, we can say, okay, once we get the reports and we will, yes, of course, there is a treatment. And sometimes if you don't remember the treatment of any disease, don't to worry. Okay. So I will consult my colleague and I will let you know. Meanwhile, just go through the investigations because right now I'm not sure of the dosage or anything. Simply say this, patient wouldn't mind, examiner wouldn't mind. What they mind is wrong information, wrong dosage. That they mind a lot. This is the things we like need to correct. Like this is a very mistakes. Okay, so here we just wind up because I I don't think so. Okay, we complete the whole cases. So okay, so things we usually I'm going to tell the like 4 things what we do wrong or what we can do that rightly. First, history. Try to take the comprehensive brief history, not the undergraduate that okay, what your like family, any like detail, we do take the undergraduate, okay, wow, habits, and then this, then until unless it's related. Focus history, take a focus history. And examination also start should be the focus examination. Then what can you do? Take a like safety netting which we almost 90% candidates forget because of the stress, because the things we forget is basically we are not performing in our daily routine life. Practices is not there. They are not there because in our healthcare system, especially from Pakistan, if I'm talking about, or the other, so there are health practices are something not slightly different. So that's the reason we are not performing on daily basis, that we missed. If we'll try to apply in the practices, it's going to be more helpful for us. And then what we can do change, and also the follow-up. Like if sometimes last time even I told you, I'm again emphasizing on this point, that it's it's fine if you don't remember the follow-up, it's fine, but at least call them back after 1 week. If you are starting any medication and the follow-up medications, just please be aware of that some medication side effects and the drug interaction should be there. Just tell the patient everything. This is what like needed to do. This is where we lacking. We can diagnose, we can treat. What we can't, who are not doing is follow-ups at needing, and there we get the lose the marks. We lose actually the patient. And also try to deliver the information which is required. Not much information. Why you want to give all the medical knowledge to them? They don't need it. They are not asking for it. They just want to be healthy. They want to be resolve their issues. So try to resolve. And psychosocial, like something if related to anything, what is this illness, is this problem affecting their mental health? It is very important nowadays. Even the before, mental health is always a priority, but the thing is that people realizing it now, so we have to work on that. Okay, so as thank you, Dr. Rakshanda. Thank you so much for your time and for your experience to share with us. I hope so it's going to helpful for so many people. And we wish you a very best of luck for your results and for your further journey of, okay. So thank you so much.
Kavita. Okay, okay. Thank you, Kavita.
Okay. So this is how it's gone. Okay, now people who are there, I hope it would be going to help to you in the OSCE and your further like practices. So just one request, just like and subscribe the page and share if you find it useful. Thank you.